Medicare Part D is by far the most confusing part of Medicare. And to make matters worse, if you don't set up your Medicare Part D properly, you could be on the hook for permanent penalties. That's why today I'm going to make things super easy for you to understand so that you not only can avoid these penalties, but you can also know exactly how to get your prescription drugs covered for the lowest cost with Medicare Part D. Let's quickly go over the basics, because if you don't understand these three foundational things, you're going to have a much harder time understanding the more complex side of Medicare Part D. And the first thing to understand is, where does Medicare Part D come from? A lot of people think that everything for Medicare comes from the government. Over here we have, we'll call this the federal, well, it is the federal government. So we have the federal government that offers Medicare to the public. But with Part D, over here we have private insurance companies, and private insurance companies is where Medicare Part D comes from. So it is a public-private partnership. Public meaning the federal government, private meaning private insurance companies. And Medicare Part D comes from insurance companies. So it is the government and insurance companies working together. So how does this work? Well, the government provides the funding for insurance companies to give Medicare Part D. So since Medicare itself does not cover prescription drugs from a pharmacy, this means that you'll need to enroll in a separate Medicare Part D plan for your Medicare, but from an insurance company. This is an important distinction because some people think that Part D is included when they first sign up for Medicare, but that can lead to penalties and other issues that we're going to talk about more in a bit. So if you don't get prescription drug coverage when you first sign up for Medicare, then how do you get it? Well, the second thing to understand is that Medicare Part D can come from two sources. And this is the standalone Medicare Part D plan that you get from joining an insurance company's plan for Medicare for prescription drugs. And the other is the Medicare Advantage, which is also from insurance companies, but includes more. So if you have a standalone prescription drug plan, then you're going to just have coverage for your prescriptions from an insurance company. But approximately somewhere around 53% of people with Medicare have gone the Medicare Advantage route. And instead of only getting their prescription drugs from a Medicare Advantage company, they are getting all of their health care from Medicare Advantage. And so they have their doctors, their hospitals, their medications, everything included in Medicare Advantage. Now, I want to point out one other critical thing. Not all Medicare Advantage plans have prescription drug coverage. Medicare Advantage is often called MA, Medicare Advantage, but it can also be, and usually is in the variety of MAPD, Medicare Advantage Prescription Drug Plan. So there are versions of Medicare Advantage that do not include prescription drug plans. Those are MA only. Oftentimes we call them MA only because they're Medicare Advantage only, meaning they have your health care, but not your prescription drugs. Many Medicare Advantage plans are the MAPD, which means they are Medicare Advantage and prescription drug plan all together in one plan.
The annual enrollment period is upon us, but it only lasts until December 7th. I always recommend that you shop for Medicare plans to see if you can save money or find new benefits. And if you want help, you can call us at the number on your screen and we will show you your options at no cost to you. Okay, now back to the video.
Now, the place that we see people usually do the standalone prescription drug plan is when they stay with original Medicare only and maybe have Medicaid, or when they're on original Medicare and have a Medicare supplement. So people with a Medicare supplement that we also often call MedSup for short, or often it's also called, only by the government I feel like, Medigap. Medigap is a term that the government uses for MedSup. Not many people use that term. Most people call it a Medicare supplement. But if you have a Medicare supplement, that does not include prescription drugs. And so people with Medicare supplements usually get a standalone prescription drug plan. And on average, the cost for a prescription drug plan in 2025 is $36. That's the average monthly cost for a prescription drug plan. But we see costs that are as high as 100 plus and as low as $0 a month for prescription drug plans. So they can be kind of all over the map, and we'll talk about how you decide which one to choose. But at the high level, standalone Part D plans, those are usually for people with Medicare supplements. And people with Medicare Advantage, they usually choose the MAPD so that they have their prescription drug plan all together with their Medicare Advantage. The last point that I want to make that's really critical about this slide is that regardless of which prescription drug plan type you get, whether it's the standalone prescription drug plan or the Medicare Advantage prescription drug plan, the rules that I'm going to show you today apply to both. And so the structures can be slightly different because the insurance company could choose to do something different. But the overarching structure of a prescription drug plan will be the same regardless of whether you get it standalone or in a Medicare Advantage plan. Okay, the last of the three foundational things that you need to understand about prescription drug plans before we move on to their structure and how they work is what type of medications are covered under prescription drug plans. And typically we're talking about prescriptions that are filled at a pharmacy. So if you are getting your prescriptions filled at a pharmacy, that is typically going to fall under Medicare Part D or prescription drug plan. But sometimes you get your medications at a doctor's office. Think about injections. Think about things like chemotherapy. Chemo is delivered in a clinic at a doctor's office. So those things over here, if it's getting filled at a doctor's office, that actually falls under Medicare Part B. And so there are many medications that are under Medicare Part B that are not part of Medicare Part D. The general difference and the way that you can usually tell the difference between a medication that falls under Part D versus Part B is where it is delivered. If it is at a pharmacy, it's almost always going to be under Medicare Part D. If you're receiving it in a doctor's office, it is almost always going to be under Medicare Part B, but there are exceptions. But it gives you the foundation to understand what we're talking about in terms of which medications are being covered under your prescription drug plan. Okay, so to summarize these first foundational basics, Medicare Part D is provided by insurance companies in partnership with the government. It can be attained by enrolling in a standalone prescription drug plan or through a Medicare Advantage plan that includes drug coverage, and it covers medications at pharmacies. So now let's dive a little deeper and answer the question, how much are you actually going to pay for your prescription drugs? So on the next slide, let's talk about coverage stages and drug formularies. Whenever someone asks me how much their drugs are going to cost on Medicare Part D, I always wish that I could just answer, oh, it's going to be $10. Oh, it's going to be $50. Oh, it's going to be $100. If only it were that simple. Unfortunately, it's Medicare. And things are just never that easy. They're never that simple for us to explain because there are lots and lots of variables. So let me simplify how drugs are priced on Medicare Part D so that you can figure out how much you will have to pay for your prescriptions. When it comes to costs, there are two things that you need to know about: coverage stages and drug formularies. Now, this sounds complex, and I'm going to make it really simple, I promise. But when I start talking about coverage stages and drug formularies, usually people start to get that glossed, overlooked in their eyes like, oh my gosh, what is he, he's going to bore me to death. I will try and make this very simple, and you can understand that, I promise. So stay with me. The first one means that your Medicare Part D plan generally is going to make you pay more at the start, and then you have to maybe hit a deductible. And then as you go through the coverage stages, you will pay less over time, especially if you hit your maximum out of pocket. So let's talk about these three coverage stages. These are I'll call them the payment rules. That means that these are the rules that all drug plans have to follow. Now, this is their minimum. They have to at least do this. They can give you more benefits than this, but at a minimum, they have to follow these payment rules. Now, there are three coverage stages. The first coverage stage is the deductible coverage stage. And in the deductible stage, it's just like any other deductible in healthcare. You have to pay the full cost of your medications until you reach your deductible. Whether it's $5 or $250, you have to pay 100% during the deductible. And in 2025, the deductible is $590, which means you're paying everything until you've spent $590. Now, some insurance companies decide to wipe that out. There are many insurance companies that have a $0 deductible, particularly on Medicare Advantage side. But if you have a standalone prescription drug plan, in most cases, you're going to pay the first $590. Once you've spent that deductible, you go into the second phase, which is called the initial coverage phase. And in the initial phase, now you have copays and what you're kind of used to, right? Your company is going to help you cover the cost of your medications. So this is what most people are used to when they come onto Medicare is that what's my copay for that? You go into the copays. Now, generally speaking, generics will cost less than brand name drugs when you're in this phase, while you can get the drugs your insurance company prefers at a lower cost than the drugs that aren't preferred by your insurance company. And I'm going to go into more detail about that in a bit. But in 2025, once you have spent $2,000 out of pocket, you then go on to the third phase, which is the catastrophic phase. And in the catastrophic phase, you pay nothing. So remember, in order to get out of the initial phase and move to catastrophic, you had to spend $2,000. Once you spend $2,000, you then can move to catastrophic. And once you're in catastrophic, your costs go to zero. So that means that your maximum out of pocket for medications is $2,000. And once you get to the catastrophic stage, you are essentially done paying for your medications for the rest of the year. Now, few people actually reach this stage. But if you're someone who takes very expensive medications, then you know that $2,000 is the limit for you, and that can be a lifesaver for you. Also, in 2026 coming up, the $2,000 is going to go up slightly. It will be in 2026, it's going to be $2,100 to get out of the initial coverage phase into catastrophic. And remember, in 2024, we used to have the donut hole, which was actually the third phase. Catastrophic used to be the fourth phase, and in the donut hole, you had to pay a lot out of pocket. So, thanks to the Inflation Reduction Act, that is gone now. And once you hit the $2,000 max out of pocket in 2025 or 2,100 in 2026, you no longer have to pay for medications. Unfortunately, that has driven up the cost of Medicare Part D because you can't offer more benefits without it costing more. But it has made the program better for people who were hitting their maximum out of pocket or hitting the donut hole rather, and really suffering through that. So in a really simplified version of this, during the deductible phase, you pay 100%. During the catastrophic phase, your insurance company pays 100%. And in the initial phase, you pay your copays. Now let's look at drug formularies because this is a really critical part. All of these coverage phases, they don't count if your drug is not in the formulary. And once you understand how this works, it's actually pretty straightforward. So let me explain. Drug formularies are built by the plan. The plan decides what the formularies are. Now, oftentimes we'll see something like a four-tier formulary, which means there are four groups of medications. But sometimes we've seen 6 tiers, 5 tiers, 7 tiers, 8 tiers. It depends on your company. And a drug formulary is simply a list of all the medications that your drug plan covers and how much you'll pay when you get that. And it can change from company to company. So you have to be careful which company that you use. And most insurance companies are going to divide their formulary into tiers, with each tier having a fixed price or a percentage. So let me show you an example of how one drug plan does this. And remember, this is just one plan. It is a plan with 4 tiers. Like I said, some have 5 tiers, some have 6 tiers. But in this example, we're going to do a 4-tier plan. Here's an easy way to think about drug tiers. Typically, the more affordable drugs are going to be all together because they're not expensive for the insurance company and they're going to have a similar copay. The more expensive a drug gets, usually the higher tier it will be. Not always the case, but tier 1 will be more affordable, tier 4 will be more expensive, and that's usually what we get. So in this plan that I'm going to give you an example of, tier 1 is what we call preferred generics. And preferred generics would be more affordable generic medications for the plan. And in this example, we would say that these would be, like $10 each month. Tier 2 would be non-preferred generics. So now we have the more expensive generics because even with generic drugs, they can be more or less expensive. So these non-preferred generics, they might be $25 in this example. They cost more because they're more expensive generics. That actually does exist. Then we go on to tier 3. And tier 3 now we have our preferred brand name drugs. So we'll call this preferred brand. And these might be $45. a month. A preferred brand name would be your most common brand name drugs. They would be not terribly expensive brand name drugs. And then you would have another tier where you have the expensive brand name drugs. And this tier 4 would be the non preferred brand name drugs. So non preferred brand will be more expensive. This might be more like $95. And these are your more expensive brand name, non brand name medications that are non-preferred. And non-preferred doesn't mean uh, anything other than really expensive. That's really what it means. Then we typically have a final tier, which is tier 5. And this one is specialty. And specialty, that's a code word for very expensive. And in the specialty tier, oftentimes we'll see something like a 25% co-insurance. Co-insurance means you are paying a percentage instead of a co-pay, which is a solid figure. So, non-preferred $95, you're going to pay $95. But on a specialty tier, if it's a $1,000 medication, you could be spending $250. So that's a typical tier outline of preferred generic, non-preferred generic. Then you have preferred and non-preferred brand, followed by a specialty tier for the most expensive medications. And you will pay these amounts until you reach your initial coverage limit, which I said in 2026 is going to be $2,100. Once you do that, once you pay that until you reach your limit here, and then after that, you are going to reach catastrophic. And regardless of how expensive the medication is, you will pay zero. And that's how this coverage stages coincide with drug formularies. In this example of a preferred generic being only $10, if that generic actually costs $25, when you're in the deductible phase, you're going to pay the $25. You're going to pay the retail cost. If a non-preferred brand name is actually $500, when you're in the deductible phase, you're going to pay $500 because you're going to pay the full price. And once you've hit the deductible, then you'll start paying only the $95. So that's how the two work together. It's really a critical thing to understand how they work together. Again, there are many plans, particularly on the Medicare Advantage side, that removed the deductible so that from the beginning of the year, you just have copays. But if you have a standalone prescription drug plan, you most certainly are going to have the $590 deductible and pay the full price before you get to start paying those copays or co-insurance until you hit your maximum and go to catastrophic coverage. I hope this is very helpful and helps you understand how the drug plans work and how the coverage stages work together with the drug formularies. The last thing I really need to explain to you about this topic here is that there are some medications that are not in the formulary, and every insurance company can create their own list of drugs. And so if you choose a plan that doesn't have your medication in any of these tiers, you have to pay all of the costs. It is not covered unless it is in the list. That's why whenever you're researching Medicare drug plans, it's critical to check the plan's formulary. If you don't, you could end up with a plan where you pay hundreds of dollars for your prescriptions, where there's another plan that covers it at half the cost. So those are the costs that you need to be aware of when you enroll in a Medicare Part D plan. It's really critical to know what's in the formulary. And that's something that we do for you here is we go through and look at all the formularies for all the drug plans available and run your medications against them to see which plans cover all your medications. But now for the last question, how exactly do you enroll in the Medicare Part D? Now, before I show you that, let me just jump in here and say that if you like how we simplify Medicare and how we make this easy to understand, then please hit the like button. Medicare Part D is extremely complicated, and so many people make mistakes on it, which is why we're doing everything we can to help as many people understand exactly how it works. And if you'd like more simplified videos on Medicare, then be sure to subscribe and let us know what you'd like us to explain. All right, back to the video. I'm going to show you now how to enroll in a Medicare Part D plan, because remember, there are permanent late enrollment penalties for Medicare Part D. If you don't enroll on time and you don't do it right, you could end up with lifetime penalties. Now, for most people, you'll want to enroll during your initial enrollment period, which is when you first are eligible for Medicare. We call it the IEP, which is Initial Enrollment Period. It is 3 months before you turn 65. It is the month that you turn 65, and it is 3 months after you turn 65. So you have a 7-month window. During that time, you can enroll in Medicare. It is the same enrollment period for when you join Medicare. Now, if you have prescription drug coverage from somewhere else, like VA benefits, TRICARE for Life, your employer health plan, then you may be allowed to delay your enrollment past your initial enrollment period. And then you can have a special enrollment period where you can enroll, which that means when your coverage ends or when you retire, then you'll be able to enroll. And as long as the coverage that you had while you were working or from your other source is creditable, which means it's equal to or better than Medicare Part D, you can delay without penalties. Once your coverage ends, that's when you get your special enrollment period and a special enrollment. So we had IEP and SEP, and a special enrollment period means that you'll be able to enroll in a Medicare prescription drug plan at that time and not get penalties. Because remember, the penalties are permanent. So you don't want to make that mistake. The late enrollment penalty is 1% of the national average premium per month that you were not enrolled. Now, in simple English, that today equates to approximately 36 cents per month. So 36 cents per month. I'm saying that and you're saying, well, that's not too bad, 36 cents a month. Well, consider that this is a permanent penalty. It will stay with you for a lifetime and it grows because that 1% per month, 36 cents per month, 1% of the national average premium. That means the national average premium is $36. Without doing all the complicated math, what I'm telling you is that the national average premium keeps going up. So in the future, it's going to go to $50. And the penalty will also increase to 50 cents. See what I'm saying? So it's important to understand lifetime penalties can be very painful. So let's say that you delayed for 2 years. 2 years is 24 months. So you went 24 months without coverage. What is your penalty going to be? Well, at 24 months, we're going to take 24 and we're going to multiply it by 0.36. And I'm not that good at math on the fly, so I already did the math for you. It's $8.64 a month. So you're going to pay $8.64 a month for the rest of your life. It starts to add up. That's the point here. And it's unnecessary. There's no reason why you should be stuck paying penalties, right? So I have known people that have had years and years, 5, 6, 7, 8, 10 years of not having a drug plan, and then they go to join and they're paying $30, $40 a month more than everyone else. It's frustrating, right? So what we're doing here is trying to help you to avoid the penalty because if you understand how to go about this, you won't get stuck with one of those lifetime penalties. So how do you enroll? Let's go back to this image here and talk about how you enroll in a prescription drug plan. If you're considering enrolling in a standalone prescription drug plan, there's 2 things you need to consider: the monthly cost or the premium of your plan and the plan's formulary. You can go to Medicare's website. They have the Plan Finder tool, and you can put in your medications there. It will show you a list of prescription drug plans in your coverage area that cover your medications and will tell you how much you spend for them. I'll leave a link for this tool in the description below. I personally do not recommend that that's how you choose a plan because an insurance agent can go much deeper and explain more things and see things that are not necessarily available always on Medicare.gov. The same is true for Medicare Advantage. And Medicare Advantage is definitely more complicated. Remember that with Medicare Advantage plans, it combines all of your healthcare coverage with your drug coverage. So aside from your monthly costs of your plan, you also need to consider your plan's formulary. You need to consider which hospitals are in the network, which providers are in the network, which doctors are covered. What is the network? You want to know how much you're going to pay when you see your doctor, how much you're going to pay when you go to the pharmacy. You need to know what types of extra benefits your plan has, like does it have dental, vision, and hearing? You need to look at the plan's star ratings. Again, Medicare Advantage is much, much more complicated than a standalone prescription drug plan. So you can use the Plan Finder tool on Medicare.gov to find a Medicare Advantage and prescription drug plan. However, Medicare's tool doesn't give you some very important details. It doesn't give you a full formulary even. So you don't know which of the full list of medications that are in the plan. You don't know which hospitals and doctors accept the plan. You won't see a lot of the fine print. You won't see the details, the fine details, and the full enrollment guide for each plan. That's why if you're serious about finding the best Prescription drug plan, the best Medicare Advantage plan for you, because there isn't one best plan, but there's a best for you, then I highly recommend working with a licensed insurance brokers. Insurance brokers can see all the details of all the plans that are available in your area. They can listen to your specific needs and find the plan that will give you the lowest cost and the benefits that you're looking for. So if you're getting a Medicare Advantage plan, then they'll take into consideration both your healthcare needs and your prescription needs. All of that, of course, comes at no cost to you. Medicare insurance brokers like us are paid by insurance companies. We are paid to help you. So if you need help, contact our team of licensed insurance agents by calling the number on the screen. Everyone who works here knows me personally, and I know them personally, and they all work on salaries. They are not paid commissions. So if you'd like to search for plans on your own, though, then check out the next video I'm going to show you, where I do a full walkthrough of how the Medicare Plan Finder tool works on Medicare.gov.